So some of the things that hormones are healthy and optimize in healthy aging, or some of the symptoms, I should say, that go along with declining of hormones are this list that you see in front of you. And I'm happy to tell you my own story as well. When I was creeping into my 40s, I started to feel a lot more tired. That afternoon fatigue, felt like I needed coffee or could take a nap. Mood swings were a little more off than usual. Anxiety, I always had just this hurry up and wait, or just this heart race kind of anxiety all the time. More irritable, poor sleep. Does anybody ever have trouble falling asleep? Or do you fall asleep fine, but then you wake up in the middle of the night for no reason and have trouble going back to sleep? Or if you were like me, I could fall asleep, be asleep, and hardly even wake up and still feel tired, like I wanted to sleep more. That was my symptom. Memory loss. Anybody walk into a room, forget why you walked into a room? I was doing that all the time. Or just meet someone and forget their name instantly. That brain fog or depression, just feel like you're on a hamster wheel. Remember that movie the movie Groundhog's Day? Get up, go to work, come home, repeat. Hot flashes and night sweats. Here's a good writer downer. Hot flashes and night sweats are two different hormones that are associated with these symptoms. A hot flash typically is more likely to happen in women versus men, but it can still happen in men. It's something that starts in the middle of your chest, right? Flushes up. It could last 10 seconds or 40 seconds. You could have one a day or dozens a day. That is typically an estrogen deficiency. Anything other than that chest and flash of heat is a night sweat. So a night sweat, of course, yes, can happen at night, right? Sweat, throw off the covers, crank up the AC, turn on the fan, or it could be during the day. You're just hot. And that was one of my symptoms. Would get out of the shower, you're getting ready, and I'd kind of start perspiring and you're putting on your makeup, or get in a car and just getting hot. It wasn't that flash of heat, but it was just being hot. That is typically a testosterone deficiency. And too many times, I think, patients will go to possibly their OB-GYN, and Dr. Huang, you can confirm with me or not, and they say, I'm having these hot flashes, but it's really a night sweat. And some other providers that don't understand the difference between the hormones and the symptoms immediately might associate they need hormones, or they need estrogen, and write a script for estrogen. And then you have what I call the bad Bs. You have bitchiness, breast pain, bloating, and bleeding. And it's not fun. It makes PMS look like a walk on the beach. So those two, estrogen deficiency or testosterone deficiency, is something that a lot of providers may not take the time to identify. Would you agree, Dr. Huang?
Yeah, I agree. In standard practice, it's not recognized that one set of symptoms is caused by estrogen and another set is caused by testosterone. That's correct.
Yeah, thank you. And then, of course, weight gain, joint pain, migraines, severe headaches, bladder systems, and then decreased sex drive and or performance and libido. These are all symptoms that could indicate that your hormones are not optimal. I didn't say normal. They could be normal. I don't like that word, because what really is normal, but they're not optimal. And we are reaching for optimal to help clear these symptoms.